Sure. So why did we have this session? Because at the moment there is confusion. We think, what signature? Is it important? Can we make treatment decision making? Randomized trials available? So for now, for the last 10 years nearly, we've had signatures developed by microarray technology, gene expression. Out there, you can buy these tests to apparently help you make decisions about how best to treat your patients. But there are multiple tests. They've been tested in different ways, using different clinical trials, different patient cohorts, different marketing strategies. And so in general, I think there's a lot of confusion for the clinicians who don't keep up to date with the literature. So we've decided to have a consensus panel to invite experts. And the consensus panel will consist of two parts. There will be literature review, where all the literature will be analysed related to each signature. That's available for clinicians at present. And will be graded in an objective way. This is how it's been done, this is the level of evidence, this is what the conclusions of those articles say. And then we'll have some clinically relevant questions and ask the panel and the audience also, how can these signatures help us, or can they help us today, and should we be using them? And so this part will not be so literature, will be based on the literature, but also the opinion of key expert leaders. And I think that's important as well, because sometimes we don't have the level of evidence there, but people are still using the test. So it's good to know whether people are doing a thing that could be helpful or harmful to their patients. So this is why we're having this consensus panel, and we're very excited about it, and we think this will be a really fun last day. And similarly, the second question will be about molecular subtyping. So, the luminal A, luminal B, basal-like, non-basal-like, this again is very confusing. And so we think it also would be helpful for people to have key opinion leaders give their opinion about how best these could be used, if at all, in clinical practice, and also for the research setting. People have identified that basic science moves at a different pace and clinical medicine moves at a different pace. And for clinical medicine, of course, you need to be much more slower because you are treating patients. So you need to have a high degree of certainty, but certainly you need to be able to efficiently translate the good things from basic science into the clinic. And this is why IMPAKT is so important, of course, because often clinicians and scientists don't even talk to each other. And so this is why the meeting was conceived, to get people in the room, to have discussion, and the more discussion there is, the better. And because we have such great people there coming, this is why the meeting is so exciting, and this is why you should come to the meeting, basically.
Yeah, and it's a very small attendance meeting, very family atmosphere, so friendly atmosphere, so it's very worth coming for
and you
everyone.
Can speak to everybody, people that you often see up in the fast stage at ASCO or AACR, and they're there in front of you, so having a drink, and so this makes the meeting very nice.